Communities throughout regional South Australia face many challenges accessing healthcare. The tyranny of distance, lack of after-hours services, and limited opportunities to speak to health professionals are among them. This results in unnecessary trips to emergency departments, long waits to see a GP, and increased anxiety for patients. A 24/7 remote health monitoring service that will improve access to urgent care is now available throughout rural and regional South Australia. It involves patients checking their vital signs at home using a special kit, including a smart tablet. Patients monitor their blood pressure, oxygen levels, pulse rate and temperature, and upload results to a secure website. A specialist nurse reviews the results and speaks to the patient live on screen before deciding the next steps, which could include escalating care to an after-hours doctor. This thorough assessment process enables appropriate care for patients. The patient's GP can view their results at any time, enabling them to track their condition and amend treatment if required. 24/7 remote health monitoring is for patients at risk of visiting emergency departments due to a worsening condition, including heart and respiratory disease, infections, and during post-operative recovery. It is also for regional aged care facility residents and COVID-19 patients with underlying chronic health conditions. Dr. Henry Becker of Kapunda and Udunda Medical Practice has been one of the first doctors to adopt the service.
My name is Dr. Henry Becker. I'm a general practitioner at the Kapunda Medical Practice. Managing patients with chronic disease is a large part of my practice. What I mean by chronic disease, I'm talking about hypertension, diabetes, heart failure, respiratory problems, or all of the above combined. We are here pretty good at managing those patients. However, there is an issue with access to care. If you consider that a medical practice is only open from 9 to 5 Monday to Friday, and if you take in account all the hours of the day, including holidays and weekends, you will find out that unfortunately we're only open 20% of the time. So when those patients feel sick and they have an aggravation of their condition, they have no other choice but going to the hospital. This is quite frustrating for the patient. They go to the hospital, they get treated, then they go back home until the next cycle. It's kind of a roller coaster for them, and it also goes with quite an expensive cost to the taxpayer. Our healthcare system has not really changed over the past 100 years. You have on one side, you have the doctor's office, surgery, and on the other side, you have the hospital. It's perfect if you have an acute care condition, which if you have the misfortune to be in an accident or if you need your appendix removed, it's perfect. But intuitively, it's not really the best situation to treat a chronic condition in acute care setting. Fortunately, now we are introducing telemonitoring, which is in essence providing in the home of the patient devices which allows us to monitor them 24/7, blood pressure machine, thermometers, a device to measure their oxygen. And with those devices, we are able to essentially detect early changes of condition and avoid a hospital admission. Being in a rural environment is not necessarily a problem for the practitioner because we have the site where we can see our patient. However, for those patients, particularly the one with chronic illness, they may have a transportation issue. They may not be able to leave their home. So the telemonitoring is absolutely essential in providing the appropriate care for those patients. This is the beginning of a radical change in the way we practice medicine for those patients. We are no longer going to the hospital. We are now bringing the hospital into your home.
24/7 remote health monitoring will reduce hospital presentations, provide patients with round-the-clock assurance, extend the care of GPs, support diagnosis and treatment, and help patients to remain at home. And the service is free. 24/7 remote health monitoring, improving healthcare in regional, rural, and remote South Australia.